You hear each extract and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a physician talking to a patient called Pamela Erickson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. What's your problem?
Well, doctor, I have itchy red rash on my feet.
Okay, what's your age?
21, doctor.
Tell me if you have developed any associating symptoms or signs.
It is tingling persistently, doctor.
Since how long have you had this problem?
For the past 4 weeks.
Exactly on which part of your foot you are getting this problem?
Right great toe, right second toe, right third toe, and right fourth toe. Often the onset of itching starts after removing sweaty socks.
Do you drink or smoke?
I do not smoke, but I do drink.
Have you had any diseases in the past?
Well, I had chicken pox and frequent ear infections.
You had any surgeries as well?
I have surgical ear tubes.
Do you take any medications?
No, doctor.
Are you allergic to any medicine or substances?
Well, I get a severe rash when I access adhesive tape.
Any of your family members have any history of illness?
My paternal grandmother is having cataracts, and my maternal aunt has migraines.
Well, your physical examination reports show blood pressure 110/64, respiratory rate is 18, heart rate is 66, and temperature is 98.6. Lower extremities is warm to cool, proximal to distal. The dorsalis pedis artery pulse palpable bilateral. Posterior tibial artery pulse palpable bilateral. No edema observed. Varicosities are not observed. Right great toe, right second toe, right third toe, and right fourth toenail show erythema and scaling. Muscle strength is 5 out of 5 for all groups tested. Muscle tone is normal. Inspection and palpation of bones, joints, and muscles is unremarkable. You have developed tinea pedis, a fungal culture of skin from right toes. KOH test shows no visible microbes. I am prescribing Lotrimin AF 1% cream to apply 4 times a day, and Griseofulvin 250 milligrams PO once in 8 hours for 4 weeks.
Extract 2. Questions 13 to 24. You hear a doctor talking to a recently admitted patient called Roy Miller. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Roy, I see from your notes you've been admitted because of shortness of breath. Can you tell me more about that, please?
Yeah, well, it started last week. I noticed that getting up the stairs was more of an effort, and I found that I had to pause on the way to catch my breath.
Right.
I did used to get a little out of breath, but it's definitely gotten worse. I normally manage to go shopping with my wife, and we walk to the shops and back. I generally have to have a little rest, but now everything is just taking me longer. I feel weary, you know? And I've got this cough. It's like a barking thing that I just can't shift. It's worse at night when I'm lying down and I get a bit wheezy. I'm just really tired because it keeps me awake for most of the night. My wife has been sleeping in the spare room because it's keeping her awake. I've also sort of been bringing things up when coughing. Without being too graphic, it's quite thick. It's a sort of dirty green color, I suppose.
Right.
It wasn't like that at the beginning of last week. It was just clear. But over the last couple of days, I've noticed it's changed color, and I'm coughing up a lot more. My wife was starting to get worried, so she made me an appointment with our doctor, and then he sent me here.
Okay, well, do you have any other symptoms?
Yeah, I was really hot yesterday, and I thought it was because the heating was on, but my wife hadn't turned it on. Then the next minute I was shivering. I guess I'm feverish.
It sounds like you've been really suffering. Have you got any other medical conditions?
Well, I was diagnosed with this lung condition last year. I've forgotten the name of it. Hold on. Hang on, I'll get it. COPD, is that it?
Yeah.
Well, anyway, they told me that my lungs weren't working as well as they could be because I used to be a smoker.
Right.
But I quit about 6 years ago. To be honest, I think it was because I worked in the mines and it was really dusty. Either way, I've got it, and it makes me a bit breathless, but nothing like this.
Right.
And I also get gout from time to time, and I take something called allopurinol or something. I've also got arthritis in my knees, but that's just because of my age, so I just put up with that.
You mentioned taking allopurinol. Are you on any other medication?
Well, the doctor gave me inhalers, and I'm using those. I'm getting better at taking them because I found it a bit confusing at first. I've started to take my blue inhaler a lot more over this last week because I've been so breathless. I take the stuff I mentioned before, a statin for my cholesterol, and then the odd paracetamol when my arthritis starts to play up. I don't really like taking pills, but if it keeps me going, then it's worth it. Also, I'm allergic to penicillin. I get an awful rash all over my body, and it's so itchy whenever they give it to me. Don't give me any of that.
We won't, Roy. You mentioned you live with your wife. Are you both managing at home?
Oh, yeah. We still get around the town to get our shopping and see the family. The stairs are starting to get a bit much now, so we're thinking about moving into a bungalow, but we haven't started looking yet.
Okay, that's good. Have you got any ideas as to what might be going on?
Well, I think it might be a chest infection because it's just getting worse. I just want to start feeling better.
Of course, Roy. It does sound like that might be the case, but we'll start doing some tests to make sure and begin treatment.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a physician explaining about the treatments for major depressive disorder. Now read the question.
A major depressive disorder is one of the most severe, troublesome, and costly psychiatric diseases. Although there are pharmacological and non-pharmacological treatments, often antidepressants are used more frequently than psychological interventions due to inadequate resources. Our efforts are to promote the evidence-based prescription of these antidepressants in the future. Therefore, we are now focused to update and expand our previous efforts to compare and categorize antidepressants for treating a major depressive disorder. All antidepressants were more efficacious compared with placebos while treating the adults with a major depressive disorder. While the effect was lesser in the placebo-controlled patients, the variation in efficacy and acceptability was more in the patients treated with antidepressants. Therefore, these findings should promote the evidence-based prescription of antidepressants and apprise the physicians, patients, and policymakers on the merits of various antidepressants. One of the most crucial challenges worldwide is the routine prescription of antidepressants for the treatment of a major depressive disorder. Nevertheless, in the scientific literature, there are considerable ongoing debates about the effectiveness of antidepressants as well as the potential differences in tolerance and effectiveness due to individual drugs. With the introduction of new antidepressants into the market and the increasing numbers of trials published every year, we have realized the significance of systematic review and meta-analysis to synthesize the evidence in this crucial clinical issue.
Question 26. You hear a nurse briefing a colleague at the end of her shift. Now read the question.
Okay, so the next thing is about Susie Williams in bed 3.
Right.
She's been admitted for chest pain to rule out MI. So far she had an EKG, which was okay, and the first set of cardiac enzymes and troponins are negative. When she came in, her blood pressure was elevated a little, like 182/95, but she was given losartan, and at 6 o'clock it was 142/82. She was also dehydrated, so we started her on IV fluids. D5, half normal saline, running at 125 millilitres. That can go until midnight, and then it can be disconnected. She's scheduled for a stress test tomorrow and some more enzyme tests. Okay?
Okay.
Question 27. You hear a dietitian talking to a patient. Now read the question.
So what seems to be the problem?
I feel such a failure. I'm sure people think that if I just tried harder, I could lose weight. Maybe I need more willpower.
Well, firstly, well done for seeking medical help. Actually, being overweight or obese is a medical problem because being overweight changes how your body works.
Oh, thanks, but I do feel that it's my fault for being this way.
Well, I hear what you say, but please understand that these days we consider that obesity is a disease, like high blood pressure or asthma. You see, the body's signals to the brain stop working correctly when you're overweight, and with time you feel less full, even if you eat the same amount. And when you cut calories, your body tries to use less energy to keep your weight the same.
Question 28. You hear a monologue by a physician explaining about lupus disease. Now read the question.
Lupus is a chronic autoimmune disease in which the immune system becomes hyperactive and attacks healthy tissue, resulting in such as inflammation, swelling, and damage to skin, joints, blood, kidneys, the heart, and lungs. Normally, our immune system makes proteins called antibodies to protect and fight against antigens such as bacteria and viruses. However, lupus makes the immune system unable to differentiate between the healthy tissue and antigens, which leads the immune system to direct antibodies against the healthy tissue instead of antigen.
Question 29. You hear a consultant talking to a trainee about a patient's eye condition. Now read the question.
Have we got Mrs. Kent's notes?
Yes, they're here. She's coming in today for possible laser surgery for her retinopathy, isn't she?
Well, depending on results. And from the look of these pictures we took last time, there's been a slow improvement. So we'll talk to her, and perhaps hold off for the time being. Unless her condition's worsened, because it can in some cases.
So what's the cause?
Well, we know a leak of fluid behind the retina causes the distorted vision which sufferers get, but not why that occurs. There may be a link with stress, and also steroid use, but the jury's still out, I'm afraid.
Question 30. You hear part of a hospital management meeting where a concern is being discussed. Now read the question.
Now I'll hand over to Jenny, who has a few words to say about staffing. Jenny?
Thanks. Now, if we compare ourselves to other hospitals of the same size in other regions, we're actually recording lower rates of staff turnover. That's just as well, given the challenges filling vacant positions across the sector. Where we do compare unfavorably is in the number of days lost to sick leave. That's making it hard to maintain full cover on the wards, and we all know the costs of that. As a matter of urgency, then, HR are looking into the worst affected areas to understand the reasons behind it and to see if there's anything we can do to help and support the staff involved.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear the lecture given by a physician on the topic white blood cell disorders. You now have 90 seconds to read questions 31 to 36.
White blood cells are predominantly involved in fighting infections and participating in inflammatory reactions, while red blood cells carry oxygen to the body. Platelets help stop bleeding. The normal number of white blood cell ranges from around 4 to 11 billion cells per liter. Newborn babies have a higher range from around 9 to 30 billion cells per liter, which goes down over the first 2 years of life and is similar to adult normal ranges for the rest of childhood. Opposed to red blood cells, the normal range is not affected by gender. However, it is affected by race. In national studies, African Americans have lower baseline white blood cell counts than Caucasians. There are several different ways to categorize white blood cell disorders. First, they can be categorized by cause, those that affect white blood cell production and other factors that affect the function of the white blood cell. Secondly, white blood cell disorders might be categorized by which type of white blood cell is affected. In some disorders, all the white blood cells are affected, but others only affect one type. There are 5 major types of white blood cells: neutrophils, which predominantly fight bacterial infections; lymphocytes, which predominantly fight viral infections; monocytes, which predominantly fight fungal infections; eosinophils, which predominantly fight parasitic infections and are involved in allergic reactions; and basophils, which are involved in inflammatory reactions. Thirdly, white blood cell disorders can be classified as benign or malignant. The majority of white blood cell disorders are benign. Generally, too much of one type of white blood cell is suffixed with philia on the end of the word, and too few of one type of white blood cell is suffixed with pinia, which is applicable to all types of white blood cells. For instance, leukophilia is a white blood cell count above the normal range, and leukopenia is a white blood cell count below the normal range. These can also be applied scientific white blood cells, such as neutropenia, with too few neutrophils, or basophilia, with too many basophils. Leukophilia is an increased number of white blood cells. The most common causes are infection, medications like prednisone. Autoimmune neutropenia occurs when the body secretes antibodies that attack and destroy neutrophils. Patients with severe congenital neutropenia are born with severe neutropenia secondary to genetic mutation and have recurrent bacterial infections. Cyclic neutropenia is caused due to genetic mutation, similar to severe congenital neutropenia. However, the neutropenia does not occur every day, but in cycles of about 21 days. Leukemia is a cancerous white blood cells produced in the bone marrow. Chronic granulomatous disease is a disorder where multiple types of white blood cells become unable to function properly. It is an inherited condition and results in multiple infections, particularly pneumonia and abscesses. Leukocyte adhesion deficiency is a disorder where the white blood cells are unable to move areas of infection.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear an interview with a neurosurgeon called Dr. Ian Marsh, who specializes in the treatment of concussion in sport. You now have 90 seconds to read questions 37 to 42.
My guest today is Dr. Ian Marsh, a specialist in the treatment of concussion in sport, and a co-author on a new set of guidelines. So, Dr. Marsh, what's the aim of these new guidelines?
Well, the aim was really to provide a resource, not for the top-level professional sports people, but for parents, teachers and coaches of young people playing sport.
Mm-hmm.
The guidelines basically offer some expert information from a GP, an emergency physician, and myself as a neurosurgeon about what the condition is, also how to identify the symptoms and how to manage it. If any of your listeners have ever had a concussion doing sports, you'll know how frightening it can be. It's confusing and painful and difficult sometimes for teachers, parents, or whoever to work out if someone with concussion is okay. I mean, we hope to remedy that.
And how do we know when someone is suffering from concussion?
Well, obviously, if the person's actually knocked out, it's clear. But not all patients actually lose consciousness. Often, following a hard knock to the head, they become disorientated or experience headaches, nausea, or vomiting. These are signs of concussion, and they may clear initially, but then return when the individual actually undertakes further physical activity, when they start to train, say. So it can actually take quite a while for things to really clear up. The essence of it is that people shouldn't start playing again until those warning signs have completely subsided.
Yes, and you say that waiting anything less than 14 days after all the symptoms have cleared would be too early to return.
Yeah, that's right. If they go back too early, they risk a second concussion, and as we know from professional athletes, they may have to give up their sport if they have too many concussions. So it's better, particularly in a young person with a developing brain, to allow all of the symptoms to settle and only then return to play. Well, usually return to train first, then return to play after that. It used to be thought that receiving another concussion could lead to severe brain swelling, and that could be fatal, or at least involve a visit to the emergency room. I think the evidence is fairly slim for that. What we do know, though, is that the compounding effect of having one concussion followed by another seems to be more severe than just the one. So it's always better to let the brain recover fully before playing again.
Right, so who's at the highest risk of sports concussion?
Well, actually, a concussion can happen whenever anyone receives a blow to the head. Usually it's a sort of twisting blow, not a straight-on blow. But obviously, people playing sports like rugby, where there's bodily contact, stand more chance of being at the receiving end of such a blow. But having said that, it's just as likely to affect kids kicking a ball around a park as it is to affect top professional players in big matches.
Do you think that youth sports need specialist concussion doctors on hand, like the professionals do?
There's always a risk, and we know that it happens from time to time. But I mean, most games, even the most dangerous ones, are without incident at all. I think people who are involved in running youth sports, whether they be referees, coaches or parents, can be made aware of how to manage concussion, the signs that they need to look out for, and maybe the warnings of something more serious so that they can take the appropriate actions. But I think always having a doctor on the sidelines where young people are playing is just an overreaction.
Right. In the USA, college football is big business. They're trialling helmet sensors and impact sensors. Do you think that's something we need everywhere?
Well, I don't think it'll come to that. I think there are two scenarios here. The first is one where a concussion's a one-off event following a significant blow to the head.
Right.
The second's quite different and involves chronic traumatic encephalopathy. This comes about particularly in American football, where players use their helmets and heads almost like weapons. That type of repeated impact seems to add up over the player's career. That's something we've heard being discussed, mostly in the USA. Naturally, there's interest generally in protecting players, particularly in the professional levels of sport, but I see that as a different matter to the management of concussion itself.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.